you've got sciatica. How do you deal with it? What can you do at home? And when is it appropriate for you to see a doctor? Sciatica is a symptom set that describes pain, burning, pins and needles, or numbness into the hip and down into the foot. Most frequently, it starts here in the actual glute, goes down through the hamstring, goes to the outside of the leg, and finally terminates into the foot. Some people will have lower back pain that accompanies that, some people won't. So don't assume that you do not have sciatica if you do not have lower back pain. The first one being your pain is so bad that you cannot walk. You are ambulatory. For that, I would go to the emergency room. The second reason why I would go and see a doctor is if you have pain, burning, numbness, symptoms down all the way into your foot that are constant. It does not matter what you do, you cannot get that symptom to centralize. The third reason that I would go to a doctor is if you've had pain for more than 6 months. If you've had sciatica for more than 6 months, you are going to want to see a specialist for that. If you don't fall into one of those aforementioned categories, it's okay to do a little bit of self-diagnosis. Sciatica that comes from the lower back typically starts symptom set in the foot and then works its way up. Sciatica that originates in the hip, specifically at the piriformis, is going to largely display symptoms from the glute down. So depending on how you feel your symptom set will largely dictate what you can try to do at home to improve things. For sciatica that is originating in the lower back, I want you to try 2 exercises for only 2 weeks. Because sciatica of the lower back is inherently more serious than sciatica of the hip, you want to keep yourself on a short leash. Do not perform any of these exercises if they cause an increase in numbness or an increase in symptom set. The first one that you are going to do is a simple cat-cow. So go ahead and arch your back, look up, and then make that movement in its opposite. Round your back and tuck your chin. Pedal through about 10 to 20 of these for 3 sets. And then as you finish, I want you to just relax into child's pose. Breathe here into your belly. Push into your thighs with each inhale and hold that for 2 minutes. For sciatica of the hip, you have a little more leniency. Try this movement for 4 to 6 weeks. If you do not see an improvement, I would then go see a healthcare provider. If you do see an improvement, continue doing the exercises. It's called a nerve floss. Lie on your back, keep your chin tucked, grab behind your thigh, straighten your leg so that your your shin and your thigh are at a nice straight angle. Pull your foot down, point, and relax. You can do those for sets of 10 to 20. Try it 3 times. You can do all of those exercises every day. Again, if you are not getting consistent improvement with the sciatic nerve glides, you have about 4 to 6 weeks before you should see a doctor. I have full movement demos for all 3 of those movements on my YouTube channel. I'll go ahead and put the cards either in this corner or that corner. If you do end up needing to see a doctor and you are in the tri-state area, I'm going to put a link to my website in the description. If you are not, but you would continue to like seeing educational content like this in terms of how you can get rid of chronic pain yourself and when you need to see a doctor, go ahead and like, subscribe, and thank you guys for watching.